Good morning, everyone. Thank you for joining us virtually for the cutting of our mobile medical van. Community Health of South Florida is so proud to present you with our new state-of-the-art unit today. This has been a year in the making, and we are really excited that you could join us for this. Without further ado, I would like to start with our President and CEO, Brodes H. Hartley, Jr.
Good morning, everyone. I want to thank you all for coming out today on this occasion for the ribbon cutting of our mobile medical van. We are so proud to be able to provide this services to the community. This event occurred in a moment with Commissioner Moss, and he wanted to do something for the public housing facilities. And we left him with the idea of doing something for him and fulfilling his desire to serve the public housing facilities in Miami-Dade County. And as a result of his initiative and his idea, his vision, we have today for us a mobile medical van. And this mobile medical van will be providing services to public housing facilities here at this location, the Perrine Gardens, Arthur Mays Villa, Pine Island, Homestead Gardens, and also the homeless encampments within our area. We are living through a tumultuous time, especially with COVID-19, and we still have a problem with the inequality of healthcare services for the people, especially in our communities. And this provides an opportunity to address that inequality. We have always reached out at CHI to the community. We have our outreach teams that are out there every day signing people up for healthcare insurance, providing assistance and informing them. But now we are going to take the services to the people, all right? And so they will be able to get quality primary health care services, including pediatrics and behavioral health care services through this mobile medical van. I want to thank Direct Relief and the Health Resources and Services Administration. We certainly want to thank Commissioner Moss. Many of you may not know that Commissioner Moss, throughout his career, has provided support for health services, whether it be CHI or whether it be the Joint Jackson South Hospital, or whether it be the South Dade Health Center. We also have with us this morning Mr. Michael Liu, the Development Director for Public Housing, and Victoria Mallet. Our services from this center will be covered by health insurance. And also we provide a slide-out-based on income to support the services. And so without further ado, I want to present our next speaker, Commissioner Moss.
Good morning. Let me first of all say to Colonel Hartley and the CHI team, thank you so much for your years of service in this community. Let's give them a big round of applause. I also want to thank the officers over here to my left. Let's give them a big round of applause. They help keep this community safe. I want to thank Director Liu, Public Housing Director. Let's give him a big round of applause. When I had a conversation with CHI, I wanted to make sure that we were able to provide additional health services to our residents in public housing. When I retired from the Richmond Prime Optimist Club, one of the things that we tried to do in South Dade was to bring more health services into our public housing developments. And this was a great opportunity in talking with CHI to do that. I want to thank Director Liu and his staff for working with us in order to make that happen. And today we will begin to provide services to our residents in public housing. Now, why is that important? It's important because as we face this pandemic, many people are afraid to go in for health services. And so if we're able to provide those health services where they live, in public housing in this case, we'll be in a better position to serve those particular residents. I also want to say something to the residents who are here or who may be listening in, that we're going to make a difference in this community. We're going to rebuild this complex through the RAD program, where we're going to bring in new facilities, new amenities, swimming pool. Director Liu, you listening? Swimming pool, meeting rooms, exercise rooms, the same kinds of amenities that you find in other developments in Miami-Dade County. We want to make sure that the residents of public housing have those same developments, those same amenities, and that will happen through the RAD program. I have asked that for every housing development in my district, every public housing development in my district to be included in the RAD program. And so again, this will be a great asset to have this mobile unit, to be able to go around to all of the different public housing developments and to bring the services home to the people. Again, we're in a very different environment, a new normal. I want to encourage everyone to, the rules. I'm going to put my face mask on just as soon as I get through talking, but keep your face mask on, wash your hands, and make sure that you're social distance. And so with that, again, thank you everyone for making this happen, and we look forward to providing more services to our residents in public housing. Thank you so much.
Thank you, Commissioner Moss. At this time, we'd like to welcome Miami-Dade Development Director Michael Liu to speak.
Well, thank you very much. As you can tell, there's a lot of passion in making this intersection between healthcare and housing happen. Commissioner Moss is a living example of that passion. Colonel, with your passion and your years of dedication, both in the armed services and with CHI, amazing work. It was a no-brainer for public housing and community development to say yes. I mean, all we have to do is provide a little bit of power and space. And CHI is providing the dollars, the expertise, and the manpower and woman power to make this work. We certainly want to reach out to all of our public housing residents, to those in the homeless community that may also need services, and this is an example of what local government can do. And I was talking to the Colonel before this event, and we're going to take this as a model to the federal level to say, listen, you need to support this with real dollars, and we're going to make that happen. We're going to make that happen. So Commissioner Moss, thank you so much for bringing this amenity to the residents of public housing in South Florida. CHI, Colonel, thank you so much for all the work that you and your staff do. And to everyone else on this wonderful day, thank you very much. We are going to make a difference. Thank you.
And at this time, we'd like to say a few words in Spanish. Eunice Hines, our Director for Migrant Health and Outreach Services, will join us. She will be heading up this project as well. Eunice.
Gracias y buenos días. Estamos muy emocionados de presentarle nuestra nueva unidad móvil, a la cual se va a traer muchos servicios médicos para todos aquellos que viven en el sur de la Florida. Ahora pacientes podrán coger ventaja de los servicios de salud primaria para adultos, pediatra para niños y salud mental para adultos y para niños también. Tenemos seguros médicos y ofreceremos nuestros servicios de calidad en escala de paga variable según su ingreso. Pero esta unidad movible es nuestra segunda unidad para SAI. La primera unidad móvil se dedica a servicios dentales, la cual ha sido muy exitosa, viendo más de 3,000 pacientes en escuelas, cuidado de niños y en comunidades como esta, en que necesitan atención aquí en el sur de la Florida. A medida que avancemos en este año 2020, nuestra visión sigue la misma, y abogando por la igualdad en el cuidado de salud de todos. Gracias a la colaboración de Commissioner Moss, Direct Relief y Administración de Recursos de Salud y Servicios, HRSA, estoy muy orgullosa de esta compañía CH, cerrando una brecha, asegurando que todos, independientemente de su raza, independientemente de los ingresos que tengan acceso a una atención médica compasiva y de alta calidad. Gracias.
Thank you so much, and thank you to all of our speakers and guests today. Without further ado, I'm going to invite all of our VIPs over to take a photo, cut the ribbon, and tour the mobile medical van.